Should I worry about CT scan radiation for stomach cancer? When facing a diagnosis of stomach cancer, your medical team may recommend a computed tomography scan, or CT scan, to help understand the size, location, and spread of the tumor. These scans are incredibly useful because they produce detailed images that guide treatment decisions. While it's natural to wonder about the safety of radiation exposure from these scans, it's important to know that the benefits usually outweigh the small risks involved. CT scans use ionizing radiation, which is a type of energy that can potentially cause damage to cells. However, the amount of radiation from a typical CT scan is relatively low. For example, a standard abdominal CT scan generally exposes a person to about 10 millisieverts of radiation. This is roughly equivalent to a few years of natural background radiation that everyone is exposed to from the environment. The estimated increase in the risk of developing fatal cancer from such a scan is about 1 in 2,000. To put that into perspective, the average person's lifetime risk of developing cancer is about 1 in 5. So, while there is a tiny increase in risk, it is very small compared to the overall risk of cancer over a lifetime. It's also worth noting that younger patients tend to be more sensitive to radiation, so doctors carefully consider the necessity of each scan and try to use the lowest possible dose that still provides clear images. Modern CT technology has advanced significantly, allowing for high-quality images while minimizing radiation exposure. If multiple scans are needed to monitor the progress of your stomach cancer, your healthcare team will weigh the benefits of each scan against the cumulative radiation dose, always aiming to keep exposure as low as possible. Avoiding necessary scans out of fear of radiation could delay diagnosis or treatment, which might lead to worse health outcomes. Accurate staging and monitoring are crucial for choosing the right treatment plan, whether that involves surgery, chemotherapy, or other therapies. The small risk of radiation-induced cancer from a single or even a few scans is generally considered to be far less significant than the benefit of obtaining vital diagnostic information. If you have concerns about radiation, don't hesitate to discuss them with your doctor. They can explain why a scan is needed, how they will minimize your exposure, and what safety measures are in place. Remember, the goal is to ensure you get the best possible care while keeping your safety in mind. Overall, the use of CT scans in stomach cancer diagnosis and management is supported by current medical guidelines and is considered a safe, essential tool in your healthcare journey.